I think the healthcare crisis is bankrupting the American dream.
It's a matter of access, and it's a matter of access to quality care.
So many people are turned down because of pre-existing conditions.
I have health insurance now. That doesn't mean I'll have it tomorrow.
We have a lot of people in our area that have lost jobs.
The young people coming up today will go someplace where there's really good places to get good insurance.
It costs more when you're in a rural area. One shot they gave my husband, just so they hoped he could make the flight to survive to get him to St. Louis, was $5,000.
And if it's too expensive, they have to choose.
Should I keep my insurance or should I pay my house note?
We just fell in between that crack.
We made $10 a month too much
to get any government assistance.
But I can't afford $1,600 a month for health care premiums.
When you're in the middle, which thousands of people are, you worry about it every day.
We had a furniture manufacturing business for 18 years. We were providing health care insurance for the employees for several years, and then it became too cost prohibitive to do that any longer, and we ended up dropping it in 2006. My husband and I had always wanted to have our own business and do something that we could grow and control and help provide a decent living for us and other family members, and that's part of the American dream.
I have insurance, but even having insurance doesn't mean you're going to get the quality health care that you need. My husband had had a colonoscopy test, and he got seriously ill that night. He needed a CAT scan.
I had bladder cancer, went in, had it removed. At that point, the insurance company decides that I canceled my insurance, which I didn't. They then refused to pay for the medical care on the cancer. We fought and fought and fought for about 8 months.
And they didn't give him a CAT scan when he was in the emergency room. With a little digging down with the lawyers and different things, we were informed that the hospital got a kickback from the insurance company if they did not use that CAT scan machine over a certain amount of times because it was saving them money.
Right now, I believe we have over $20-something thousand in medical bills from the cancer, from this and this and this.
I personally felt like a failure when we had to drop the benefits and felt that that was the beginning of the end of us offering a good business in Maine. And a year later, I had a heart attack, and I remember begging the ambulance not to take me to the hospital because I didn't have health care, and I knew I couldn't afford the bills. So, and I remember telling the doctor that was putting the 2 stents in me doing the surgery, I told him the same thing. No, you can't do anything, I don't have health insurance. And he informed me that that was not his priority, that he was going to take care of me. True story.
Sometimes I feel that I should just quit worrying about the cancer, drop my insurance so that my daughter can have insurance, so we can get dental for her, so that we can, get some other things taken care of for her, and just sacrifice myself. As a man, that puts a burden on you. You feel like, because you can't take care of your child, you're not a man.
So I often wonder if I'm making bad choices, that I should be getting my priorities straight. Should we give up the car so we can have the health insurance? What are we doing wrong that we can't afford it? Because it must be something we're doing wrong and not the system that's failing us.
It's the everyday normal American out here that's being hurt by this.
We need to start putting people before profits.
People are looking for genuine reform.
Include everybody in your plan.
Cut it down so we can actually afford it.
I would gladly pay more taxes.
If it meant that everyone could get good quality health care.
I think our Congress people,
They should be listening to the public. No special interest groups. Just get right down to nitty-gritty bare facts and
Listen to the people that put them there, us voters.
There's a lot of us that aren't yelling. We're pleading. We're asking.
I urge Congress to get up, get moving, stay on top of this.
I ask that Congress
please help us.
The rural areas.
Working people, farmers,
The average Joe, me and you.
wives, us mothers, to pass meaningful health care reform.
Reasonable health care.
to cover pre-existing conditions.
To help America bridge the gap.
So your everyday worker can afford it.
Otherwise, where will we be?
This is number one, to get taken care of.
Get this done now.
Let's work this out, not let it be a Democrat, Republican thing, let it be an American thing.
If we were your family, what would you want for your family?